Okay, I'm Bismark D-Asare with WASHCost Ghana, which is also hosted at KNUST, University of Science and Technology. Yes, I can say something about rural water supply financing in Ghana. Initially, the government policy was community capital cost contribution, but now it is no more. It is more or less government funding it completely. But the onus now lies on the communities to run their own, to be in charge of the operation and maintenance cost, which so far with the WASHCost experience has been a bit challenging with some of the communities who believe themselves to be poor or less endowed. And what happened is most of the facilities are there. Communities might have about 3 or 4, probably overserved. But what happened is there is less attention in terms of operation and maintenance because the facilities might be more. But even if it's left with one, what happened is they complain of not having enough funds to repair or to fix them. So you find them leaving them and going back to the informal water sources, which are not hygienic enough. So what we found was that most of these facilities are broken down, and communities seem not to be bothered, even though they are worried, and they don't really know how much it really costs them to fix. Actually, WASHCost has been able to identify some costs, but as to whether these are ideal costs is something else. So what we are doing now is also to come up with ideal costs compared with what we really found on the ground. And I think it's coming up very well, and I think stakeholders, CWSA is involved trying to look at the cap managed aspect, which is the capital maintenance. And I think in all, we are on a good platform, and there is going to be a good progress. And probably after we've been able to identify a good cost, the ideal one, then it will be put on the table. Whether government looking at the cost-benefit analysis, government can take that cost to save money, because when people fall sick, the cost of accessing maybe national health insurance is comparatively higher than fixing a borehole or a hand pump. So that is what I can say about financing.